What I now want to shift to is now I want to put on my clinician hat, all right, and speak to and reflect on what what has developed over the years in my practice as a psychologist, as a clinical psychologist, seeing clients and learning how to integrate and drawing from their context. And key of the context that they would bring with them into the therapeutic context are their cultural frames, are their religious frames. So remember also the context in which I worked. I worked in a context, overwhelmingly black context, and what I mean by black is all the shades of black in the South African context. And people would, for instance, would come from a background of traditional African religion, where they've been socialized, you know, with themes around ancestor veneration, whether they support it or whether they've got conflicts about it, bewitchment, you know. And so there would be the traditional African issues that would come into the therapeutic context. Then you would have your Christian clients who would say, I would actually, you know, I've got issues with coming to a therapist because I'm a Christian, right? And then there would be Muslim clients who would say, well, in my religion, I'm not supposed to, or I'm not allowed to, or, you know, and so in dealing with clients like this, I had developed certain practices and attitudes that I feel helps to actually use the best of our clients' spiritual tradition for the benefit of their therapeutic journey. So for instance, one of the key things that I would say is that, look, when I see clients and I draw on their spiritual traditions, the first thing that I need to make clear is that I'm a psychologist, I'm not doing spiritual care. And so and then when I see a client, I make absolutely sure that they understand that they are responsible. When they come and see me, they are responsible for their own growth and for their own development, all right? And that the expectation that I have is that they will be accountable for their own positive and their own negative behavior. So they come in with that kind of contract, all right? And then the first thing that I do, that I shifted into as a therapist, as a clinician, is that I have an openness. I have an open attitude where I welcome the whole of the client into the room. So you don't have to park. If you are very strong feelings about your religion, or you're into traditional or religious cultural practices, you bring that with you. So that's the first thing. I think as a therapist, one needs to be open. And sometimes you have to say certain things to make a client feel, yes, but that's okay, we can talk about that. We can talk about the fact that you're Christian and you feel you've got very strong feelings, or you feel actually coming to see me is a sign of weakness of faith. We talk about that. So I allow the client to actually bring into the room also their religious issues or concerns that they might have. Then secondly, what I do is I draw on, I had developed what I call an Afro-Eastern model of self. So I've drawn on Eastern and African understanding of the self, that the self is collectivist, the essence of the self is spiritual, that the self has actually got all these multiple components. When I introduce this to the client and I say to them, look, this is actually my understanding of yourself, I also find that that helps the client to feel comfortable to bring their culture into the room.